Thank you for the invitation to Madrid Plus Vision. I'm not a frequent lecturer, so I prepare some sort of collage presentation based on my experience and how can drive innovation and the difficulties and the barriers for innovation here in our environment, mostly due to cultural, financial, political reasons. So this is my presentation, and I start with inspired in the articles by the Harvard Business Review, which make a very short resume with the idea in brief. Okay, this is the problem. Read it calmly because I'm going to repeat over and over again the same thing. The problem is, as you can see, that technology is important, but technology is not everything. You can see it. And the next one. Real innovation. I want to stress this point. And technology alone will not deliver the care we need. And the next one is the challenge. And the challenge, again, is that the health services have the potential to develop innovation, but health services need an entrepreneurial spirit, need innovation, need to be in a political context, in a cultural context, which is very, very important. It's critical, actually. So this is a clear case. This is a clear case to strengthen the life sciences ecosystem. This is critical to me. This is the reason why we are stressed. This is the situation, or the reason why healthcare services are facing difficult times. Those are the health expenditure as a share of GDP in 7 countries. You see Canada, Germany, United States, France, Japan, and average OECD. As you can see, there's some sort of plateau in the last years. And for the poorer countries of the group, you can see here Estonia, Ireland, Spain, Greece, and Portugal. And even in some of those countries, as is the case in Spain, the health expenditure has decreased during the last couple of years. Well, take into consideration, in any case, that health outcomes are not strictly related to health expenditure. And an exact example of what kind of innovation produce a real transformation in medicine, the Harvard Business Review Healthcare Innovation Insight Center identified 10 innovations. And as one could expect, they're related to different things, to organization, they are related to processes, to sciences, to technology. You can see here, which is checklist, environment, behavioral economics, patient portals, payment innovations, evidence-based decision making, 6.1, a new way to organize virtual visits, regenerative medicine, genetics, endocrine practice, and surgical robotics. So you can see there are very different kind of innovations that are needed in healthcare services. Some of them are technological, some of them are organizational, some of them are pure technology, pure science, but most of them are a mix of all of those. Well, but what exactly healthcare can do? Well, this is the opportunity for healthcare services to do something on innovation. First thing is focus on patients. So identify specific healthcare need for which current solutions are inadequate. Well, focus on patients is not that self-evident. Some health services focus, not exceptional, focus on their own people. So focus on patients, try to identify specific needs. Encourage the adoption and diffusion at pace and scale of innovation in the health system. Maximize the potential of partnering with medical technology companies. Give access to new diagnostics tools and new treatments in the shortest possible time. But those things can be done in isolation. They need profound changes in the environment. This is, I like this model a lot. It's a model built by a guy called Daniel Eisenberg from Babson College. I find this very, very interesting because it takes 6 domains that are very interrelated. So policy, finance, culture, supports, human capital, and markets. Those are really important. All those together, no one in isolation. All those domains are needed to create an entrepreneurial ecosystem. But I would say that it's the same thing for an innovative ecosystem. It's always the same. So we don't have much time, so I'm going to put the magnifying glass on public policies specifically. Why public policies? It's not only because of the time. It's because it's clear that medicine has made a lot of progress in the last years. The system as a whole hasn't done so. And governments, in my opinion, are to blame for this failure of organizational innovation. Because current policies here and in most places favor doing more, not doing better. And simply doing more of the same is no longer an option. Let's see. What I'm going to say now is that government action, I better say, smart government action is required. And I give you some examples. Let's start from England. Now here, Her Majesty government started a strategy called Strategy for UK Life Sciences, which I find it very interesting. This strategy has 4 key areas: translational research, infrastructure, venture investment, industrial inward investment, and NHS adoption of innovation. And 3 key principles: building a life sciences ecosystem, attracting, developing, and rewarding the best talent, overcoming barriers and creating incentives for the promotion of health innovation. Almost simultaneously, the NHS launched this program, which is called Innovation, Health and Wealth. I like this model because it reflects